Good afternoon, everyone. This is Steve Mondernock with the Association of Food and Drug Officials. We're going to get started here in about another minute or so. We'll give people a few more in before we start. Once again, we'll be starting at about 2:02 or so. Once again, thank you all very much for joining the webinar today. We're going to get started here in about another minute or so. We're just waiting for people to finish getting logged in. So we'll get started here in another minute or so. Okay, we're going to give folks about another 30 seconds, and we'll be ready to begin. Well, thank you all very much for joining us today for today's webinar. Today, we are very pleased to have with us Beth Reese, who is a Principal Associate with the Safe Food Project with the Pew Charitable Trust, and she'll be talking about root cause analysis. This project was a project that Pew has been working on for a few years now. AFTO and was an active participant in that project. Both myself and Ernie Julian from Rhode Island, our current AFTO president, participated in work on this project. Well, without further ado, let's go ahead and turn the webinar over to Beth. And one last housekeeping matter. If you have any questions, feel free to put them in the question window, or after we complete the presentation, we will go ahead and if you raise your hand, you can do an audio question. But once again, question window or raise your hand at the end. We will hold all the questions to the end. So, Beth, turning it over to you. We're looking forward to your presentation.
All right, thank you, Steve. It's a pleasure to be here. Hi, everyone. Thank you for joining today. So I'm going to talk about the guide for food safety root cause analysis that was released last month, and I'll talk about the origins of the document and why it was created, and then I'll give an overview of some of the content. And then just to plug here quickly, in case some of you haven't heard of Pew, Pew is a nonpartisan, nonprofit advocacy organization that fosters evidence-based public policy. I've been at Pew for a little over 2 years now with the Safe Food Project, and the goal of the Safe Food Project is to improve the safety of our food supply with a key focus on reducing health risks from foodborne pathogens in meat and poultry production. So, let's see here. There we go. This is just right up. It's just a link to the guide. It's in a web-based format, and then there's also a link on that web page to download a printable version, the PDF. Okay, so here's just a quick outline of the presentation today. I'm going to go over our initiative and our approach to the guide, and then I'll go over the guide itself and some of its key content. Okay, and on to the initiative. So first, just to put the value of having a safe food supply in perspective, as I'm sure many of you already know, the burden of foodborne illness in the U.S. is it's enormous. The estimated yearly cost of illness caused by the top 15 pathogens is about $15.5 billion. And an outbreak or recalls can cost companies themselves millions or just, completely shut them down. So $15.5 billion is nothing to sneeze at. And that includes medical care and lost time from work and the losses from premature death. So it's a huge public health burden. So this is a priority for Pew because root cause analysis is foundational to a prevention-based food system. And that's something that can potentially lessen this burden through prevention instead of just reacting to outbreaks. But in its current state, root cause analysis, it's underutilized, it's not always done. Its definitions and methods and findings aren't shared effectively across the food industry or with other food safety stakeholders for that matter. So there are lost opportunities to improve food safety. So this is an area that really needs a lot of improvement, and making improvements requires a collaborative approach. And this is where Pew and our project comes in. Pew developing kind of strong partnerships is central to our work and work throughout Pew. So throughout the development of the guide, we've tried to align FDA and CDC, FSIS, and then state and local governments and industry so that it really reflects issues that are relevant across all stakeholders in food safety. Okay, so on to our approach to the guide and how we put it together. So the guide was assembled with input from three main sources. So the first one was from a discussion in a series of 3 convenings in 2016 and 2017. So this guide has been around for a while. It's taken a long time to develop. Another source is research that we conducted on root cause models in different industries. And then the third source is input from working groups. So we had smaller groups drawn from the larger convenings work with us on an outline of the guide. And throughout, it's really been a highly iterative process. We've had multiple review cycles and a lot of stakeholder input in general. So the guide is the product of very collaborative efforts. And then just a little bit more about the convenings and the research component. So in the convenings, there are some key topics that were identified, and these make up the structure of the guide. And those topics were, what is an RCA? What are some considerations before conducting one? How should a root cause analysis be conducted? And how should those findings be communicated? So these were some issues that the participants of the convenings felt really needed some kind of discussion, because there's definitions and there's methods, and they aren't shared across industry or across different organizations. So this makes up the main structure of the guide. It's the meat of the guide. And then these are some of the questions that were used to guide the research component. So we asked, how are other organizations conducting root cause analyses? How do they decide when to conduct them? How do they perform them? How are the key findings disseminated, and how are they used? And then what's working and what's not working? And then to try to answer these, we reviewed public documents about that organization. We reviewed their mandate, their history, their organizational structure, operations. We also reviewed investigations by the organization. And then we also conducted interviews with former members of the organization. So this is all reflected in the guide. Okay, so our target audience for the guide is just broadly food safety stakeholders, and that includes the food industry, federal, state, local safety agencies, trade and professional associations, academia, consulting companies, And so the guide is written for practitioners, for the people conducting root cause analyses and management with varying backgrounds and experiences in different food settings. We're also considering that leadership in some organizations might be wondering if it's worth it to actually conduct these analyses, and we want to try to make a convincing case that it actually does make good business sense to invest resources in root cause analysis. And then lastly, on the history of the initiative, this is what we're trying to accomplish. These are the overall goals of putting this guide together. So we want to convince organizations to conduct root cause analyses if they aren't already conducting them. We want to improve their conduct, and then we want to improve the reporting and the communication of root cause findings. Okay, and now on to content. So this is just an overview, and I'll go into more detail on the main sections. So the guide has an introduction that it includes a lot of examples on root cause in other sectors, like scuba diving and engineering safety. And we include these to show its potential and how some of the systems that were set up around it can be valuable for food safety. And then there are various approaches and rationales for things to consider for conducting root cause analysis. That's the main part of the document, and that's organized, as I mentioned, by those 4 topics identified in the convenings. And I'll go over some key points in each of those sections. And then we have some conclusions and next steps, and then a list of resources at the end with training courses, existing training courses, root cause guidance from other industries like aerospace, and then other outbreak investigation manuals, just for example, the World Health Organization and FDA's Rapid Response Team's Best Practices Manual. So there's a lot of existing resources out there that are really great. Okay, so in the introduction, I just wanted to highlight a couple of things. It starts off with a short overview and provides the purpose of the document, which, following our goals, is to improve the safety of our food supply by encouraging the use of root cause analysis in food operations. And then the suggested usage for the guide. So it can be used as a template for companies who are developing their own practices, or if they already have procedures in. It can also be used as a reference to ensure that their analyses are robust and they're actually capturing root causes. And this also includes planning for the analyses, ensuring the process includes steps that are essential to finding root causes, and then designing corrective actions or preventive actions that will prevent the problem from recurring. Okay, and then the intro also includes pretty interesting history of the use of root cause analysis in other industries, as I mentioned before. So starting with the car industry, where Keiichi Ono at Toyota was actually credited with developing the process, at least in an industrial setting in the 1950s. We also give examples in space flight, civil aviation, oil and gas, patient safety, and recreational diving before. And then we also discuss HACCP and then modern food safety and some of the challenges associated with conducting root cause analyses in food settings, and I'll talk about those a little bit later. Okay, so this is a really powerful example from that section that I wanted to highlight, where we looked at the patient safety sector and how they communicate and share findings. So The U.S. Department of Veterans Affairs National Center for Patient Safety developed and mandated a root cause analysis process. And they also maintain a patient safety information system, which is a database of root cause analyses from VA hospitals. So this database enables analysis of RCA's impact. And one study found that postoperative complications were actually higher at VA medical centers that performed fewer root cause analyses. So I think this example really demonstrates the importance of creating some sort of platform to share analyses across the food industry. We really need to know what works and what practices can prevent accidents, and we need to share those findings. Okay, so the second section is where we define root cause analysis in some related terms. And the guide does this because one of the obstacles to improving communication identified in the meetings and the convenings was that there was a lot of variation in government and industry terms and definitions of root cause analysis. So we're really trying to standardize definitions, also understanding that stakeholders might retain their own language, but the point of the guide is to try to develop some sort of common language so that we can share information. Root cause analysis is a retrospective investigation used to identify why a problem occurred. And FDA uses the term environmental assessment. It's the same thing. So we also describe the differences between a contributing factor and a root cause. And in short, contributing factor is what happened, and then a root cause is why it happened. And then we describe the when and where and the who of root cause analyses for different food settings, and trying to keep the variation and backgrounds of our audience in mind too. So this is just an example that we use in the guide to illustrate the differences between contributing factors and root causes. We just really wanted to drive this home. The hypothetical here is that a processed food is recontaminated after heat treatment, and then it enters the market. So in this example, a contributing factor might be something where there was some sort of problem with the equipment, like machine corrosion or a valve in the plant was bypassed, and then the product wasn't monitored for post-processing recontamination. But the root causes would be something like a lack of defined maintenance SOPs, or they're unable to hire adequately trained staff. So the contributing factors are more the how it happened, and then root causes are the why. And we want to try to target the whys, the root causes, for correction. So the third section is what should be considered before conducting root cause analysis. And this is basically the planning section. The guide has some information on how to scale an investigation. There are a number of questions to consider to determine what your organization needs to conduct a root cause analysis. And then there's steps and resources for capacity building. And then we discuss this question here of how long the investigation should take. And really the long and short of that is that ideally it should take as long as it needs to. So I just want to talk a little bit more about capacity building. Assessing the capacity to conduct root cause analyses is a really important first step, and assessing what the needs are for capacity development. You have to look at the capacity of the organization as a whole to conduct root cause analyses, what resources you have available, what you might need to contract out, and what training programs might be needed, and how existing procedures are actually performing within the organization. And that's what this chart is. It's the stages of capacity development, and it's an iterative process that's meant to be, repeated so that you can identify weaknesses and build capacity. And then another component of this is identifying some core team members who are trained to lead root cause analyses, and then tapping those with the appropriate expertise for the scope or the scale of the investigation. You might have a big problem or a small problem. So on the topic of scale, the guide has a good list of factors to consider in scaling or scoping the analysis. So we also looked at what the National Transportation Safety Board does to scale an accident investigation to see if there were any ideas or lessons that we could draw from that. So after the board has been notified that there was an aviation accident, they make a decision to dispatch what they call the GO team. And then the GO team composition is very clearly linked to the scale of the investigation. So they look at, for example, and this is not the entire list, the number of injuries and fatalities, the location of the accident, the public interest in the accident, the magnitude of the task, and then previous accidents of the same type. So I think these factors are also really important in scaling food safety root cause analyses, and they're also mirrored in the guide. Okay, so section 4 is how is a root cause analysis conducted. So here we discuss what happens before the investigation even begins. So there might be, you might need to contain the incident. There might be early corrective action. You need to compose the investigation team. And then the guide provides some steps for conducting the analysis. And the steps are kind of a skeleton to work from. They're basic, but they're fairly consistent with what we saw in other root cause materials. And I'll go over those steps. And then we also cover the questions: how do you know you found a root cause? How can changes be? And then what if I can't find a root cause, or when has the investigation gone far enough? How do you know you're conducting an effective root cause analysis? So these are some general steps for conducting the analysis, but the point here is whatever steps you use, whether it's these or others, the process really needs to be systematic and data-driven. So the first step is to collect the available data and define the problem. Then you assess the data and develop a hypothesis. And then the third step here, categorizing evidence, really helps ensure that you haven't missed any important potential data sources, and it helps you identify data gaps. And then you identify the root cause or causes. So the last three steps here are just as important as the first. When this is where you can act on the findings of the investigation and design corrective or preventive control measures to prevent the problem from recurring, and then sharing lessons learned. So again, the specific procedures might vary by different organizations, but these steps are here to help ensure a consistent approach and to create some sort of standardization across different organizations. And then the guide also includes some characteristics of effective root cause analyses, and this really summarizes the main findings from our research on root cause in other sectors. And these items to look out, these are items to look out for to kind of increase your confidence that an effective root cause analysis is being conducted. So the investigation should be timely, should begin promptly after the problem has been identified. There should be frequent stakeholder communications. It should be comprehensive and systematic. There should be appropriate technical expertise available. It should be unbiased and transparent. Its conclusion should be based on and driven by evidence, and it should be clearly and concisely reported. So this might be used as something of a checklist. So in this section, we also provide a table of commonly used tools. It's not exhaustive, but there's some popular ones on there, and along with their strengths and weaknesses, and then some suggestions on when to use them. So I have an example of a fishbone diagram and a knot chart in the next slide. And at the bottom here, the five whys, you've probably heard of that one. That's another very common tool that kind of exemplifies the root cause approach. But I would just say be aware that it's very simple. It's usually not enough to just ask why a few times or 5 times. It's usually best to use this strategy in conjunction with other techniques. Okay, so this is a knot chart, and knot is just an acronym for the data categories: know, need to know, opinion, think we know. So something like this is used to classify evidence and data items throughout the investigation. So you have your data items on the left, and then you can check off how confident you are about the evidence, and then you have any follow-up actions on the right that are needed to improve your confidence in the reliability of the evidence. So this is something like this is very useful for driving decision making during the investigation. And then this is a fishbone diagram, and I know there's lots of little tiny words and stuff, but this I think this is a really good example. It's also food production based too. So fishbone diagrams, they're used to sort many possible causes, and then data and evidence without having to consider their temporal order. So these are really great for tracking and organizing information and then presenting it later to stakeholders or to your team. And I think consistent use of fishbone diagrams, they're also called Ishikawa diagrams, helps to ensure that the basic categories of causes are considered. So it ensures that you have a really comprehensive investigation. So it ensures that you're looking at external factors like environment, climate. You're looking at physical factors like machines, materials, and then you're also looking at operational and organizational factors like management or policies or people issues. So this is a really great tool. Okay, so section 5 focuses on communicating root cause findings. So the guide has a number of suggestions for report sharing. So it could be through academic or trade journals or something similar to FDA's strategy of posting environmental assessments on their website. And then the information gathered from a root cause analysis can also be used to identify the need for education or training or for some sort of new public health or regulatory policy. So there are a number of different ways you can communicate root cause findings. And then the final section are some conclusions and next steps. So here, the guide talks about the need for mechanisms and platforms to share lessons learned, particularly from industry.
We apologize for the slight technical issues. Beth, we have lost you. Could you call back in, please?
We wait for Beth to call back in. If anyone has any questions, this would be a great time to go ahead and enter them into the question box. Once again, if you have any questions, enter them in the question box or raise your hand. I'm sure we'll have Beth back with us in just a second. Yes, the slide set will be made after the presentation. You'll be receiving an email with that along with a link to the recording. That will happen Monday, actually. Okay, excellent. And we just learned the link works, except there's an extra apostrophe that ended up at the end. I'm not sure why that got there, so that's another little piece. We'll also include a link to the guide at that point, so you have it going forward. Beth, do we have you back?
Hello, can you hear me?
We can hear you. Go ahead.
Oh, great. That's so weird. I don't know what happened. Okay. Well, I don't know where I dropped off there. Let me close this screen here. I guess I'll just continue on with this slide here. So sorry about that. The guide also touches on culture throughout, and we wanted to emphasize the importance of creating a culture of food safety in an organization because it encourages collaboration. It also encourages people to ask questions without any worry about enforcement and punishment. So food safety culture is really important. And then I just wanted to talk a little bit more about some challenges that are unique to conducting root cause analyses for food safety issues, where we can't really look to other models in other sectors. First, the likelihood of identifying root causes is pretty low when an outbreak is actually identified. So finding root causes is generally more difficult as time passes. And then the RCA process and the constellation of factors that need investigation are very different for different types of products produced in different settings. So for example, an open facility like a farm versus a processing plant for something like cookie dough. So there's different product factors going on there. And then some products with short shelf lives like fresh spinach are difficult to trace back. Consumers might throw out packaging or they eat it when it's past its expiration date. So there's some consumer behavior factors going on there that are very challenging. Individual susceptibilities and cross-contamination are also complicating factors. One food item might make some people sick, but then not others, and that makes it really difficult to trace back. And then, these are some unique challenges for food safety, and they're going to require some more tailored processes or procedures and some creative solutions in the future. But I just want to emphasize that preventive and corrective actions, they can still be designed even with incomplete information. So they might be broad in scope, the actions might be broad in scope, or they could possibly be more expensive, but they're still necessary for prevention. And then every investigation is also a learning opportunity. So even if you can't find the root causes, the contributing factors could also be actionable findings. So overall, the food safety system has its weaknesses, and root cause analysis can definitely help address those weaknesses. conducting the analyses also happens to make good business sense. So just want to emphasize that the product recalls can be very costly, and then having a reputation for a strong safety record can help build consumer trust. So we hope that organizations will refer to the guide for high-level guidance and to help gauge progress for their own root cause analyses by asking, the right questions, like, do we have the right team? Does our analysis have the characteristics of an effective root cause analysis? Did we identify the root causes? And if not, do we know why? And then lastly, did we communicate our findings so that the entire industry can improve as a whole? And then again, there are many excellent existing resources out there, and we've highlighted many of those in the guide, and we think that with a significant amount of collaboration and the input we received, that the guide really provides a lot of value for the food safety sector without duplicating those great existing efforts. So that is all I have today. Thank you again so much for listening. Sorry about the technical difficulty there, and I can try to answer any questions you might have.
Sure. Well, go ahead. For those participating, please feel free to type questions into the question box, or if you would like to ask it verbally or have comments, go ahead and raise your hand and we will unmute you and get to your question. So we have a couple questions already, Beth. The first question we had is, besides the NEARS portal, are there other portals or plans for portals where the results of root cause analysis can be posted in a way to do some trend analysis?
Unfortunately, not that I know of. I think that's something that really needs development, and hopefully, plans can be made after this guide is out there for a little while, so that we do have something like that. But yes, that's definitely something that's needed.
So how would you suggest applying root cause analysis concepts in non-outbreak settings? For example, using a RCA as part of a routine inspection process focused on prevention. Any comments about that?
So I think the value of root cause is that you can use it for any type of problem. It doesn't have to be an outbreak. So if in a production setting, if something broke down, if you had so you noticed something, there was some sort of problem with the product, before it leaves the facility, you can still conduct root cause analyses and see what the problem was, and you can correct things before it actually causes an outbreak. So I think it can be integrated into existing company procedures, quality assurance programs. So yes, I think it's a really valuable process.
So one great example might be for many of you that are inspectors every day, when you have those reoccurring risk factor or public health intervention level violations at a retail establishments where you keep seeing the same problem over and over again, going to that next step of a root cause analysis and working with the firm to really figure out why is this happening and how do we permanently correct it makes a lot of sense and would be a great practice. So that just might be one thing to think about. Similar concept on the manufacturing setting also. How likely is it that a food processor would share a root cause analysis info with their competitors?
That's a really good question, and I am not sure. I think I can only make assumptions. I would assume that companies that are producing the same types of products might share, but I think if there's any worry about legal or enforcement actions, then they might not do that. There might be issues with sharing intellectual property. So I'm not really sure about that one.
So we could tell you that many of the largest food manufacturers have participated in this process in developing this guide. We're very active in the process of developing this guide. In addition, I think if you think back to some of the big outbreaks in the last 10 years, the companies involved oftentimes shared very direct and and sometimes damaging information from that resulted from their root cause analysis. I think Maple Leaf out of Canada is a good example of a really good one. A lot of the flour manufacturers have been very public about some of their challenges they've faced. Those are just two I can think of right offhand that I did a lot of work with, but those just two are good examples. Most companies today don't think of food safety as a competitive advantage. They think that they have a duty to share anything they learn in food safety across the industry, and that's pretty standard amongst that industry right now. So I think there is some ability to share there. Definitely the legal and the regulatory consequences are a challenge there, but at least when I spent my 10 years leading a regulatory agency, I was never concerned. If someone was doing the right thing, we were much more likely to not move to penalize them at that point than we were in cases where they weren't moving in the right direction and doing the right thing. So I think this is just one more thing. Root cause analysis and HACCP has many things in common. When conducting the investigation, many items may be based on confidential information. How can they be shared? So that's a great question. I'll let you start, Beth, and then I might pipe in once you get done.
Yeah, I think that that goes back again to your great answer and the question before it. I think it just depends on the type of organization and in the industry. But I think you might have another answer for that.
Yeah, I think the answer may be you don't necessarily have to get as detailed as you could get necessarily in the information that's shared. What you might be able to say is, for example, this is a difficult to clean piece of equipment because this, and this, and here are some solutions that we found to improve our ability to conduct sanitation on this piece of equipment. So, that I think you can get. You don't necessarily have to get to the level of detail, but with some level of, you can still provide some information. And I'm thinking back to, if I remember right, Maple Leaf was one of them that had an equipment issue, and they did a pretty good job of sharing that without necessarily going into proprietary equipment. So when helping people identify a root cause, I find they have difficulty distinguishing the root cause from the finding in an audit. Do you have any advice on how to explain the difference between the two?
So I think that's a very good point. That's a problem that we try to point out at the guide, that there's a difference between violations and root causes. So if a problem that's pointed out in an audit doesn't stop at why, if you can keep asking why after you found that cause, then that's not the root cause. And also, I think if you correct something that's in an audit or if it's a violation and the problem recurs, then you definitely know that you haven't corrected the problem and you didn't get to the root cause.
Yep, absolutely. Let's see. I'm not. Anyone will give people just another 30 seconds to ask any other questions that they may have. This is definitely a great guide. If you haven't taken a look at it, please do. We will be emailing out the link to the guide along with our other information from the webinar and the recording information. Thanks a lot once again for everyone that did participate. We're looking forward to this. I'm going to put a plug in for those that haven't seen it, but on Monday we will be having Cannabis 101, or how I respectfully refer to it, 420 on 420. So the interesting webinar with Leslie Engelking from the Focus group that developed the first set of cannabis standards. So please consider attending that from 2 to 3:30 p.m. Eastern on Monday. If you haven't registered, please register. Leslie's a great speaker, and it'll be another wonderful webinar. And we will be announcing a series of additional webinars once again on Tuesday. So we will be continuing regular webinars at least through May 15th for all of you that are may not be able to be in the field as much as you'd like to be. Looks like we have several, and I got a great question here, and I'm going to answer it. Was that date intentional? No, it was completely accidental, and Leslie was the one that said, "What a great day for our cannabis presentation." And so that was totally accidental on my part when I was working on that. It just happened that was the day that worked, and she's like, "How could you schedule better than this day?" So it was quite entertaining. But so now I have to make a few jokes about it. Once again, we want to thank Beth very much for participating today, and P. Charitable Trust for all their work on this project. This is a great project out there. For those of you that haven't done any training related on root cause analysis, all of the EATS courses that are available on CDC's website, I know they're down right now, but they'll be coming back in mid-June, are great courses. In addition, ASQ offers a really good in-person course periodically on root cause analysis that may be of interest also. And there are also some additional courses, I believe, on the Food Safety Center of Excellence, or the Center of Excellence at the Tennessee's Food Safety Center of Excellence website on outbreak investigations in particular. So those are all places to take a look if you're interested in learning more about root cause analysis and how it's conducted. Thank you all again for participating, and have a wonderful weekend. Beth, we really appreciate your participation today.
Thank you. It was my pleasure. Happy Friday.
Yes, thank you. Bye-bye.